In this session, I will be discussing pathologic calcification. So what do you mean by pathologic calcification? So can you tell me in human body where calcium is present? So calcium is present only at two organs in human body. Number one, teeth, and number two, bones. So the human teeth, the enamel of the teeth and the bones, they have calcium in them. Otherwise, no other organ have calcium in human body. So when calcium is present in any other organ apart from these two organs, it's pathologic. It's not normal. It's pathologic. And this is known as pathologic calcification. You got my point? So what is pathologic calcification? Can you tell me? So normally calcium, the inorganic calcium is present in the bones and the teeth. In the bones and the teeth, you can see the calcium. But whenever the deposition of the calcium salts in any tissue other than the bone and the teeth, other than the osteoid and the enamel, that is bone and teeth, it's pathologic. So that's why it is known as pathologic calcification or heterotrophic calcification, right? So this is the definition. It is, so you can say it is the abnormal deposition of the calcium salts. Not only calcium salts, a little amount of iron, magnesium and other minerals can also be deposited in any organ. Again and again, I am repeating, except bone and teeth, the enamel of the teeth and the osteoid. So that's it. Now calcification is of two types. The pathological calcification is of two types, the dystrophic and metastatic. What is the difference between them? For your simplicity, I have drawn this sketch diagram to make you understand what is the difference between dystrophic and metastatic calcification. In this diagram, you can see here is a blood vessel inside which calcium is present. Here is also a blood vessel inside which the calcium is present. In the first blood vessel, the calcium is present in normal amount. See, it's normal. It's normal amount of calcium. What is the normal concentration of calcium in human blood? It's 9 to 11 milligram per deciliter. It's normal. But in the second case, you can see hypercalcemia. See how much I have drawn. It's hypercalcemia. The amount of the calcium is more than 11 milligram per deciliter. It's hypercalcemia. Now see the tissue. This is a tissue which is dead and degenerated. The tissue is dead. And here the tissue is normal. So whenever the calcium which is normal, it is passing in a blood vessel and any dead tissue is coming on the way. So calcium will come out of the blood vessel and get deposited here. So this is known as dystrophic calcification. So basically, I mean to say in dystrophic calcification, the tissue is dead. The problem is that the tissue is dead. The tissue is dead. But the calcium level in the blood is absolutely normal. You can learn for D for D. D for dystrophic and D for dead and degenerated. So the tissue is dead and degenerated and the calcification is dystrophic calcification. You got my point? See the other diagram. In the other diagram, you can see the calcium is more but the tissue is normal. So whenever the calcium is passing from a blood vessel and it is more in concentration, so it will come out and get deposited over the tissue. This calcification is known as metastatic calcification. You got my point? So here the point is that here tissue is normal, but the calcium is not normal, it's hypercalcemia. So the problem is different. In the first, you can see the tissue is dead, but the calcium level is normal. In the second, you can see the tissue is normal, but the calcium level is increased in the blood. So you can say the two differences, the two types of the calcification. I hope you got it. Say yes. So here dystrophic calcification, here metastatic calcification. In dystrophic calcification, the calcium deposited in dead tissue. In metastatic, it is deposited in normal tissue. In dystrophic calcification, in the blood level of the calcium is normal, right? So because calcium metabolism is normal. But in metastatic calcification, the calcium metabolism is deranged. That's why there is hypercalcemia in the blood. The dead degenerated one is irreversible, but the metastatic calcification is reversible once you fix the hypercalcemia. If the hypercalcemia become normal, it can reverse, right? Now let me tell you the sites and causes of each of them. Let's start dystrophic calcification. In dystrophic calcification, can you tell me the name of the dead tissue? Can you see dead tissue can be caseous necrosis. It can be dead parasites like trichinosis, right? Fat necrosis, infarcts, that is coagulative necrosis, thrombi and hematoma. These all are dead tissue. Dead tissue. Can you tell me the example of degenerative tissue? You can say degenerative, the example is atherosclerosis, damaged heart valves, infected lymph nodes, degenerative tumors. These are the examples of degenerative tissue, right? So that is the site of calcification in dystrophic calcification. Can you tell me the site of calcification in metastatic calcification? In metastatic calcification, what is the site of calcification? Here the site of calcification is all those tissue which secrete acid from them. That is having acidic environment. That is having alkaline environment, right? The cell having alkaline environment will attract the calcium to get deposited over it. So all these organs, that is the basement membrane and tubular lamina of the kidney, pulmonary veins, lung, cornea and conjunctiva of the eye, gastric mucosa, joint, synovium of the joint, systemic arteries, tendons, these all have alkaline environment in them. That's why they are prone of having metastatic calcification. For calcium, there are two special stains available. Can you name the special stains? The first one is von Cosa. It gives a black color. See the diagram. The second one is as alizarin, red. It gives red color. See the diagram. So these are the two special stains for calcium. So that's all about the calcification, the pathologic calcification. We have learned there are two types of pathologic calcification, the dystrophic and the metastatic. In the dystrophic, the tissue is dead, the tissue is degenerated. In the metastatic, the tissue is normal, but the calcium levels in the blood are hypercalcemia, showing calcium metabolism derangement. So you have to learn the definition of both of them. You have to learn the special stains of the calcium. You have to learn the sides of both of them. So it's a small topic, yet very important. Sometimes MCQs come from this topic. So try solving all the MCQs now. Thank you.